Anterior guidance. Anterior guidance is a dynamic relationship of the mandibular anterior teeth to the lingual contours of the maxillary anterior teeth. Furthermore, the contours of upper and lower anterior teeth establish stable and holding contacts. Both upper and lower anterior teeth need to have correct contouring to provide anterior holding contact. This is very important as any instability of anterior guidance may allow interference for the posterior teeth. The articulating surfaces of the anterior teeth affect mandibular movement. The anterior guidance must be in harmony with the envelope function. It is preferable for contact between anterior teeth to separate posterior teeth in protrusion. In lateral excursion, contact between teeth on the working side separates those on the non-working side. Freedom in centric. Freedom in centric is also known as long centrics. It occurs when the mandible is able to move slightly anterior for a short distance in horizontal and sagittal plane while maintaining tooth contact. However, if the anterior teeth or posterior disclusion does not allow this horizontal movement, there will be no freedom in centric occlusion. Or in some other situation, if the front teeth hits together as hard or harder than the posterior teeth, there is no freedom in the centric occlusion as well. In these situations, they might not have the freedom in centric, which is in angle class 2 division 2 incisor relationship. And also when the anterior incisors have been crowned with two thick palatal surfaces. Dynamic occlusion. Dynamic occlusion refers to occlusal contacts that are made whilst mandible is moving relative to the maxilla. The mandible is moved by muscles of mastication and the pathway is determined by those and also two guidance determinant. Posterior determinant is the temporomandibular joint. As the head of condyle moves downwards and forwards, the mandible is moving along a pathway determined by the intra-articular disc and the articulatory surfaces of the glenoid fossa, which all are enclosed in the joint capsule. During protrusive or lateral movement, if teeth are touching, they also provide guidance to mandibular movement. This is the anterior determinant and is provided by whichever teeth that touch during eccentric movements of mandible. Lateral guidance can be classified into canine guidance and group function. Canine guidance. Canine guidance is the dynamic occlusion that occurs on the canines during lateral excursion of mandible. In canine protected occlusion, the canine guidance is the only dynamic occlusal contact during the excursive movement. Group function. During lateral excursion, the contacts are shared between several teeth on the working side in group function. Contact would be towards the anterior of the mouth and the most anterior of them would be the earliest and hardest contact. Occlusal interferences. Interferences are undesirable occlusal contact that may produce mandibular deviation during closure to maximum intercuspation. It may hinder smooth passage to and from the intercuspal position. There are four types of occlusal interferences: centric, working, non-working and protrusive. Centric interference is a premature contact that occurs when mandible closes with the condyles in their optimum position in the glenoid fossa. It involves between maxillary mesial facing cusp inclines and mandibular distal facing inclines. Centric interference will cause deflection of the mandible anteriorly. Working interference. Working interference occurs when there is contact between maxillary and mandibular posterior teeth on the same side of the arch as the direction in which the mandible has moved. It is between the maxillary lingual facing cusp inclines and mandibular buccal facing cusp inclines. If the contact is heavy enough to disocclude anterior teeth, it is considered an interference. Non-working interference. Meanwhile, non-working interference occurs when there is an occlusal contact between maxillary and mandibular teeth on the side of the arches opposite the direction in which the mandible has moved in lateral excursion. Almost always, contact occurs between maxillary buccal facing cusp inclines and mandibular lingual facing cusp inclines of the non-working side. Protrusive interference is a premature contact occurring when distal facing inclines of maxillary posterior teeth contact mesial facing inclines of mandibular posterior teeth during a protrusive movement.